The first 48 hours we were in the hospital, it was clear that all of the focus was on keeping Theo alive. It was evident from the urgency that was being shown by all the doctors, the amount of care that he was getting, the amount of attention he was getting, the amount of imaging that was being done, and the way that people were talking to us. It was clear that that was all that mattered for the first 48 hours, was keeping him alive.
Mom and Dad had noticed that he was just seeming increasingly fatigued, and so had brought him in to his pediatric nurse practitioner that day, who had noticed that he had an abnormal breathing pattern and was concerned there might be something going on in his chest. When we looked at the x-ray, typically we would expect that air is black and filling the lungs, but in Theo's case, there was a large area of white, which represented a mass of tumor cells that were unexpectedly growing in Theo's chest, and they were secondarily compressing on his heart and lungs. The most common reason for this is leukemia in kids Theo's age, which is a blood cancer that can also spread and form masses in other areas of the body, like the chest.
I was asked to look at a radiograph by a technologist and immediately noted that there was a major abnormality, which was a large anterior mediastinal mass.
This was an unusual situation because the patient had such a large mass, and the patient was uncomfortable and could not really lie down on the scanner. So as you may see on the CT scan, the nurses and the technologists and all the physician was helping. This patient was actually unable to lie on the table, and you can see the patient was almost sitting up in the scanner as much as we can do this.
And in Theo's case, we knew because of this compression that these things can grow very rapidly, and that we really only had 24 to 48 hours to figure out what this was and to start Theo on treatment.
So this was such a precarious situation that we immediately transitioned him from the radiology suite to the emergency room. And for the first time that I'm ever aware of, we started chemotherapy in the emergency room. And this was steroids. And steroids are used to immediately shrink masses of malignant cells that we think are related to leukemia. Of course, I didn't know at the time with certainty that Theo had leukemia or a similar type of disease called lymphoma, but this was the most likely diagnosis, and therefore it was a risk I had to take to treat him before knowing what we were dealing with.
Okay. So I remember having the conversation with Dr. Hastings and Dr. Hawley up in the near radiology, and then I don't know how long it took a while for us to get into the ER and get settled. And during that time, I'm calling Ari and having him come, and he's trying to find us in the ER, and he comes into the ER room and he looks at me and he's like, what is going on here? And I just mouthed to him, leukemia, and he's just like, no way.
And then Dr. Mansour showed us the image from the CT scan and again walked us through what we were looking at. And I asked him, do we need to be thinking about I asked him if we needed to be thinking about the question. And he said, excuse me, he said, don't even let it rent space in your mind.
This side of his heart, which is under lower pressure normally, is being compressed by the fluid. So this is very concerning, but often treatable without any interventions by the use of steroids or other medications, which is exactly what we chose to do that day. However, 24 hours later, this didn't look any better.
It was striking to me when I walked in the room and met Theodore how much distress he was in, because he was in a full face mask CPAP by the time I saw him, and had evidently been escalating his use of options in the ICU for respiratory support, short of being intubated, which the ICU docs also knew could potentially be a disaster if you tried to intubate the child. And Theodore, being the age he was, most kids don't like having that CPAP mask on and will try to pull it off, and Theodore wanted to keep it on, which told me that there really was a problem. He also, on his EKG, was having outward signs of having cardiac tamponade at that point as well, and I was really thinking to myself, wow, this kid isn't going to be able to make it much longer.
You know, we were able to meet as a group, to sit down, to go over all of his imaging, to talk about what his clinical status looked like, to talk about what we expected his response to be and what our concerns were moving forward. And, you know, ultimately with everyone's input and everyone kind of getting an understanding of the situation, you know, as a group we came to a consensus decision that the best option for him was to place him on ECMO.
It was truly remarkable seeing the teamwork, the amount of dedication to a single case, the amount of sleep that everyone was losing, people who had never met him before.
So the clock started at around 4:30 and we were on ECMO by 6 p.m., which is very, very quick. This is a case that our team actually has heard about in other centers. These types of cases, we've thought about them in other patients. We were confident this was the right decision for him. And this would allow not only for his heart to heal, but it would allow for him to receive the life-saving chemotherapy that he has to receive.
So again, it's the teamwork. We decided we need to do it, and within 1 hour we are all in the operating room. And step A, step B, step C was done, and it was beautiful, and we all feel good that we can save this child's life.
The cardiac surgeon went to drain the fluid around the heart, and then we realized how really precarious our whole position was, because the minute he started taking the fluid out around the Theo's heart, the mass slammed down on top of his heart, and if he hadn't been on ECMO, he wouldn't have survived.
After Theo was placed on ECMO and now was safe and stable, I had the opportunity to speak with Anne and Ari about the treatment. We also confirmed that he had T-cell leukemia, and were able to initiate chemotherapy that evening specifically to treat the leukemia. For the first time, we were able to really discuss now curative therapy for Theo.
when Dr. Hastings and Dr. Perrieri made it clear to us that we could start along the process of treating him for leukemia as opposed to just keeping him alive, we've never felt so much relief. And Ann and I looked at each other at that point, and this was the moment that we had been waiting for. We'd both been saying to each other for those 2 days, we just need some piece of good news. We've yet to get a piece of good news, and we need something. And I talked to my parents, and I said, we're just waiting for something. We're waiting to hear the word shrinkage. We're waiting to hear the word stable. And once we got the sense that that's where he was, we felt like, we were through the danger zone, and now it was, okay, now we're parents of a cancer patient, and we got to make him get better.
There's so much communication between people, and it it felt like he was in good hands, and people, when we told them that we were at Children's, they were like, your kid is in a really good spot, and so it just felt like things were going to be okay, even though you're just terrified because you have just no idea what's in store.
You want to assume that if your child has some sort of life-threatening illness, that you take him to the hospital and he gets the right treatment, and the right things happen irrespective of where you go, because that's what hospitals do. But the number of decisions that we saw being made that could have very easily been made differently somewhere else, with a less cohesive team, with people who were less responsive to all of the changes that were taking place, things could have very easily turned out differently. And I think we realized that as he was going on to the ECMO machine. He very easily could have been in a different treatment that he wouldn't have survived. And I think it's impossible to process that if you're not in that scenario, that there's so much variability to a case like this. We think about it as science, and science determines action. Science tells you how to go from point A to point B to point C. And this felt like as much art as science.